All right. So thank you, everyone. So I'm going to go ahead and get started. So my name is Jessica Herrera. I'm the manager for undergraduate student services for the Fielding School of Public Health. We're delighted that you're joining us today, and we're so excited to see that students are interested in joining our cohort of public health majors. I'm going to pass it on over to my colleagues, Kathy and Eden, and Dr. Kim Farley, who is a faculty person in our school, so that they can introduce themselves, and then we'll get started with the formal presentation part of our session.
Dr. Kim Farley, I saw that you were already off mute. Do you want to introduce yourself first?
My pleasure. Greetings, everyone. Glad that you can join. And I am a professor in residence in the departments of epidemiology as well as community health sciences. And I teach the two introductory courses on public health 50A and 50B for the pre-majors. So looking forward to seeing many of you in the class.
All right. Hi, everyone. My name is Kathy Silva. I am a first-year Masters of Public Health student in the Department of Community Health Sciences. And I also work at the College Center for Academic Advising. I serve as the College Academic Mentor, or a CAM, and with like a special subspecialty of public health. And I work alongside Eden.
Hello, everyone. Nice to see you all. My name is Eden. I am a second-year Masters of Public Health student at the Fielding School of Public Health, also in the Community Health Sciences Department. And like Kathy mentioned, I'm one of the college academic mentors with a specific focus on public health as well.
Great, thank you, everyone. Let me go ahead and share my screen, and we'll go ahead and get started with the PowerPoint presentation. All right, can everyone see okay? Perfect, thank you very much.
All right, we'll take it away now. So we'll be going over major requirements and application processes for the majors, both the BAs and the BS, as well as some information about the minors. So next slide. So we already did kind of like our intros, but just to orient you to where we're located on campus, we're down south by South Campus, across the street from the Life Sciences building. So we're on Charles E. Young Drive South, and it's circled in the red, so by parking structure 9 as well. And there's a lovely picture of our school entrance. Next slide. All right, so I don't want to assume that everyone has the same level of exposure or understanding to public health. So just to orient us, briefly, public health is concerned with the health of populations. So it's more on like a larger scale than at the individual level. So the field really looks at various determinants of health for populations, whether they be behavioral factors, community factors, cultural or environmental, policy, political, and other social factors. So we look at things like access to education and the quality of that education, neighborhood and built environment, and or economic stability, in addition to healthcare and quality and social and community context. And what the work kind of takes shape is pretty broad too. So there is disease surveillance and prevention, there's research, disease monitoring, emergency preparedness, health promotion, communication analysis. So it's a very broad field, which makes it really exciting because you can carve your own path in it. Next slide. So now what can you do with a bachelor's in public health? So undergraduates who are trained in public health practice and course concepts, they will be equipped to support the development of programs, policies, advocacy, research, and data analysis, and much more. Just a couple of like a short list of ways your career can take you in public health. You could be a social worker, a health policy analyst, a health educator, a crisis intervention counselor, even a communication specialist. So here I've just like listed, again, really wide variety of positions you can take and in a variety of settings with a public health degree. So now to break down the two major programs, we have the Bachelor's of Arts. So this is best suited for students that are interested in the artistic, business, economic, legal, linguistic, media, and policy applications of public health. And these students typically tend to focus their electives and their capstone experiences in the departments of community health sciences, environmental health sciences, and health policy and management. The Bachelor's of Science degree is more best suited or towards students that are interested in more science-focused upper division courses and more of a science-focused capstone experience as well. And some departments that they have a lot of communication with would be biostatistics, environmental health sciences, and epidemiology. In terms of the elective courses and capstone experiences, I think those are just typically what we've seen, but it's not like if you were a BS student, you would be barred from taking, say, community health sciences, because in public health, there's also a lot of intersection. Next slide. So for preparation for the major and preparation for applying, all courses must be taken for a letter grade. And we do ask or expect students to complete the following courses before they apply. Public Health 50A, which is the winter quarter course that Dr. Kim Farley will be teaching, and he'll be talking about later in the presentation. One course from Stats 10 or 13, and then one course from Chem 3, 14A or 17, or Life Science 7A or 15. So that's for the Bachelor's of Arts. Now in the next slide, you'll see that the Bachelor's of Science has a lot more requirements. So to prepare for the Bachelor's of Science degree, we do expect students to, again, complete Public Health 50A, Life Sciences 30A and 30B, one course from Life Sciences 40, Stats 10 or 13, and 7 courses from Life Science 7A, B, C, and 23L, or Chem 14A, B, BL, C, CL, and D, and Physics 5A, 5B, and 5C. And then once you are in the major, there are a couple core courses that everyone will have to take, and it's really just an exposure to all of our departments. So it's going to be the 120 series in biostatistics, community health sciences, epidemiology, health policy and management, and environmental health sciences. Now your electives is where you have some flexibility, so you can take 3 upper division courses from the school's undergraduate course offerings. You will have a community engagement component as well as a capstone experience. And then I'll pass it over to Eden to talk more about that process of applying to the major.
All right, thank you, Kathy. So now you know a little bit more about the classes that you'll need to take in order to be eligible to apply. So I'm going to go over some more eligibility requirements. So first thing, if you came to UCLA as a first-year freshman, like coming straight out of high school, then you can apply for admission to the major during like your first or second year. We'll go into when it's the best time to apply as well. If you were admitted as a transfer, then you can apply directly into the majors beginning with next year's admission cycle. But if you got into UCLA as a transfer with a different major, then you can't switch into the School of Public Health. So like we mentioned earlier, you'll also have to be either done with or enrolled in Public Health 50A during the quarter that you've applied for the major. And if you're thinking of applying this upcoming year, we are giving primary consideration to students who complete Public Health 50A this winter and then are enrolled in Public Health 50B for the spring. So that's just something to keep in mind. All right, so now a little bit more logistical timeline and requirements for the actual application. So this year for the fall 2024 cohort, we will be opening the application on March 15th, which is at the end of winter quarter, and it will close on April 5th, which is the end of week 1 of spring quarter. So like we mentioned earlier, students are encouraged to apply during the spring of their second year so that they'll be starting with their cohort in the fall of their third year. You will be applying online. So when you're applying, just make sure that you're selecting either the Public Health BA track or the BS track. You cannot apply to both, so make sure to take some time to really consider which track is best suited for your interests and your professional goals as well, because we will not accept multiple submissions. Once you're completing the actual application, a few different components to the application. First will be basic information, whether or not you want to do the BA or the BS track, and then also any extra information you might have for us about any planned absences, since it's a cohort model. If you are planning on doing, let's say, like study abroad, or some other reason where you might be gone for a quarter, let's say, please let us know about that in the application so that we can work with you accordingly. Also, make sure to list all of the courses that you've taken for prep that are either completed or in progress. And then also we would ask you for a personal statement, just explaining why you want to be part of the major and why you're interested in public health. 300 to 500 words, so it's not super long, but it's enough for us to kind of understand your interest in the major and interest in the field of public health. And then finally, a PDF attachment of your resume. Okay, so if you are thinking of, you're kind of interested in public health, you're not sure if you want to do the full-on degree program, we also offer the public health minor. So the public health minor is available to everyone while they're here at UCLA. You can apply to be part of the minor at any time during your undergraduate career, as long as you've completed Public Health 50A as one of the intro courses. So as you can see here, the public health minor is a lot shorter than the actual degree program. So you'll be taking 50A and 50B as your prep courses, and then a total of 5 upper division courses in various departments throughout the Fielding School. You'll do 3 core classes and then 2 electives of your choosing. So it's a little bit shorter, and it's helpful if you're interested in the field of public health, but not sure if you want to do the full degree program. All right, I'm going to pass it over to Dr. Kim Farley, who's going to introduce himself and the class for next quarter.
Thank you so much. And really, it's my pleasure to be with you today. I want to just mention briefly about my background. I actually started out as an electronic engineer from UC Santa Barbara, and then went on and do a master's in public health here at UCLA, followed then by medical school at UC San Francisco. And following that, I went to the Centers for Disease Control and Prevention, CDC, where I did the Epidemic Intelligence Service, which is where they put you on an airplane and you go fight outbreaks around the world. I went to the Yemen Arab Republic and to Taiwan. I also did my preventive medicine residency at CDC. For those of you who are interested in health professions, there is such a thing as a specialty in public health and preventive medicine. And then I was loaned to the World Health Organization for 18 years, including serving as the director of the Global Immunization Program at our headquarters in Geneva, Switzerland, and then head of WHO for India and for Indonesia. I came back to the United States and worked for the Los Angeles County Department of Public Health, where I served as the director of communicable disease control and prevention for some 14 years, and continued to also teach at UCLA. And then in the last 4 years, I've come over to UCLA and been both teaching at the graduate level and a course on principles of control of infectious diseases, as well as at the undergraduate level for a course in Introduction to Public Health, and now very exciting to be a part of the public health pre-major and major here at UCLA. My purpose in teaching the courses is really to show the vast scope of public health, the way it touches all of our lives, and invite you to further explore its opportunities, whether you are a public health major, a public health minor, plan to go for higher education in public health, or just simply to use the perspective of public health in your own career paths. To me, in its broadest sense, public health is about striving for social justice, to remove the disparities that make your zip code more predictive of your life expectancy and quality of life than your genetic code. To that end, the Public Health 50A course, which is the first one that you would take, Introduction to Public Health Part 1, we take advantage of a brand new edition of the textbook Public Health 101 by Jones and Bartlett. I searched a lot of introductory textbooks before choosing this one, and I find it to be very exciting and engaging textbook. Students seem to find it very interesting. It has a lot of nice ancillary materials, including interactive lectures, quizzes, web links to timely topics, discussion questions that we do discuss in class. And I find it something that really students really like. In Public Health 50A, we're going to gain an understanding, if you will, of the full range of public health, including communicable diseases, non-communicable diseases, environmental health, health policy, public health workforce, community health service, And we're going to learn that public health treats, if you will, the community rather than individuals as its patient. And I think that perspective of prevention and control will give you a good perspective no matter what professional discipline you end up choosing. That idea of raising the gaze to not just the individual, but to the community as a whole. Then the companion course, Public Health 50B, I think of it as contemporary issues in public health. That brings into the classroom, after we've now developed through 50A, a foundation in public health of its breadth and scope, this now allows us to talk about timely and contemporary issues in public health. The things that you're reading about in the paper, the opioid epidemic, gun violence is a public health problem, racism as a public health issue. We have many guest speakers in that, experts that are in their field to help us dive deeper into these topics. And I always ask these guest speakers to talk about their journey into and in public health, because one of the things I think you'll find fascinating too is how many different pathways there are to being in public health and how many different ways one can be in public health, whether it be through law or policy or public health like epidemiology. These are the types of things that we can find and explore in much greater depth. In both of these classes, we really will have opportunities to dig a bit deeper into the areas that are of interest to you through a short opinion editorial that we do in Public Health 50A and a short politics analysis paper that we do in Public Health 50B. Also, in both of these courses, you have the opportunity in groups of about 3 to 5 of your classmates to develop a in-class PowerPoint presentation on a contemporary issue in public health. Something that I think is one of the highlights of the class, and I think you will enjoy, because I think learning about public speaking is also an important component of public health. In the discussion sections, they are 1 hour a week, they're required. They'll be led by TAs that are already working together now with me in preparing for the courses that are going to be held. And they are PhD students in public health, and they're very committed and eager to work with undergraduates and mentor undergraduates. So I think you're going to find it's a great team that will be teaching. I'd also like to mention that I'm very committed to making these Introduction to Public Health courses an exciting and enjoyable experience for you. During the course, and based on my own Fiat Lux seminar that I teach on happiness, we'll have the opportunity to discuss how we can go about making career choices in life. How do these choices and our educational experience relate to our happiness? And what types of careers exist in public health? Should you have any questions about these courses, we have a few moments now, and I also am always happy to respond to you if you have some questions that come up later. Thank you so much.
Right, these are just a few more resources for how to learn more about the program, or if you have any other questions that come up after this meeting, you can contact Jessica either through like the message center, and just you send it specifically to Public Health Counseling Unit. Also, we do have some undergraduate ambassadors within the School of Public Health, so you can email them at fsphambassadors@gmail.com to reach out to one of them. Also, you can set up appointments with myself or Kathy or other college academic mentors by going to my UCLA and directing a message to us to request an appointment. Or you can also go to our Reach drop-in hours. Kathy has put the links in the chat, and request scheduling an appointment with one of us, and they'll set you up from there. We've also provided a few more general resources for public health at the bottom here, Association of Schools and Programs in Public Health, and the American Public Health Association, and also the CDC. So if you want to browse those, you can do that as well. All right, now we're going to open the floor up for any questions you all might have.